Hi, this is Dr. Pete Birchler from the Chiropractic Health Center in Chippewa. One of the most common conditions that we see in practice day to day is issues with the neck that often have an element of headache, often have tightness in the shoulders, shoulder blades, commonly some element of radiating shoulder, arm, or hand pain, numbness, tingling, sometimes weakness as well. These are the single most common thing that we see in adults at least. And in this whole current social environment with a lot of work from home and things going very computer oriented work from home, there's a lot of sitting, and so I would say there's been more of this kind of problems with sitting posture leading to the neck stress, and then the shoulder, collarbone, arm, hand, elbow, wrist, all of those kind of things there. So what I'm going to do today is just take you through a little routine that I like to do myself for the neck, shoulders, upper back to get some things moving. Maybe you could adopt something like this at home and hopefully it helps you. And then of course, if you feel like you're having trouble or you're not getting lasting results, then certainly we're here to help you. But I just want to kind of informally take you through some things here I could think can help you and kind of explain what's going on, or maybe what aspects of the condition this is particularly useful for. So I'm going to move the camera around a bit here, but let's get rolling with this. So the first thing is, for somebody who has limited shoulder mobility, they feel like they get a lot of tension or stiffness trying to elevate the arm. I'm going to show you how to use this is a broomstick, though you can use a PVC pipe or things like that. Just something there that you can use. I like a thin handled type of broomstick. All right. So for mobility, one of the things you can do is I like to take this with a real wide grip and go overhead with it. And then if you're able to actually bring it the whole way down behind your back. So I'll step back a little bit so you can have a wider perspective with it. So we're going to go overhead, really get the shoulder stretched, and kind of go down the back. And you'll see that in that back position, like my hands are open. I'm not gripping the broom, is kind of pinched in there with my thumb, so that I can make that position where I'm getting over the back and letting my wrist kind of open up. But this will really get your shoulders and some of this neck and the scapula and things to have to move. And you may find that you get a lot of tension or compression right at the base of your neck. That's really, really common. If you feel like you get pain as you're trying to do this and it hurts up here, there's a lot of compression in your spine, a lot of tension and things like that. And adjustments will really help that area to really free some things up. But you may find that in lesser severe cases, you can work through some of this with the mobility. Okay, so I like to do this and 10-15 times, really get the shoulders opened up. You can even slightly extend the neck while you're doing it, because we tend to have too much flexion looking at our phones and the computer. So you can bring the neck into a little bit of extension and look up while you're making that backwards motion. And you may find that actually allows that neck to open up, and you have less of that feeling of compression when you're trying to do that. All right, so that's just a good basic shoulder girdle mobility. All right, one thing I like to do, and this is for the spine and the shoulders, but I'll take the broomstick again, wide grip, and I'm going to hold it overhead real wide, and I'm going to do a side bend. So try to basically get the broomstick in this case to be pointing vertical by the end of the range of motion, almost straight up and down. So really going to bring some lateral side bending into the spine. And so that's going to feel really good for a lot of people. Stretch some things through the muscles of the back, through the shoulder, a bit through the neck, through the spine. And then of course you can add simple type of rotation maneuvers too. You can turn the neck with it if you want, though if you just keep your head straight on, you're going to get more of the rotation through your middle spine, shoulder blades right about that level, and that'll feel good to a lot of people, because when you're sitting, your body's kind of hanging on that mid spine, and if you can get some movement right through that middle back, it'll feel really good for a lot of people. And if you just keep your head straight while you're making those rotations, you may find that you can focus that movement in on the lower shoulder blade area a bit better. So those are some simple things for that. Another thing we'll see is when there's limited ability to lift overhead, that can be due to a frozen shoulder, which is commonly a spine problem in the upper neck, which seems weird, but the nerve that controls that motion comes out of the brain through the soft tissue of the upper neck into the trap muscle that allows that elevation. So making adjustments to that area can sometimes be just dramatically, almost like a miracle happens for frozen shoulder cases. But the longer you have a frozen shoulder, the more the soft tissue of the shoulder actually does tighten or contract. And so what this is going to show you here is a few things just to get that shoulder moving, right? So what we do is we grip the broom handle with one hand, and then the other hand, which is going to be, let's say, your bad arm in this case, we are going to just lightly grip it, and we're going to use the good arm to basically push the other arm up. So this one will just be hanging there, and the other arm is going to push it up. All right. So this hand will push the other one up. You try to leave the bad shoulder, the one that has pain when you go up, leave it really loose and passive. It's just lightly holding onto the stick, and then you use the other hand to push up to whatever range you can get. And you can go at a forward angle with it. You can go at a side angle with it. You can even take it at a bit of a back angle to whatever your body allows. But try to just get some repetitions every day and let that soft tissue adapt and stretch. And one of the reasons this works is that if there's a neuromuscular component of the pain, and you try to do it actively, if you try to lift it, it's going to hurt. But if somebody else is lifting it, so it's passive, they're moving it, but your muscles aren't engaging, you can actually get more of the range of motion, and it will help to just make sure that you get less restriction or fibrosis internal to the joint. And just doing that repetitiously over a period of weeks, you may find that you can really get a lot of the mobility back in your shoulder. All right. One of the last things I'm going to show you here is for when you're using the computer a lot, we're typically sitting and our hand is rotated. It's called pronation of the elbow and the wrist. So it's rotated like that. And people feel almost like they have, like a tendonitis in their elbow or something to that effect. They may get wrist pain and whatnot. So this is just a really simple thing to be able to take that pronation position and really get it into an open position. And I'm going to move the camera a little bit for this. All right, so the idea here is instead of having our hands in that pronated mouse position, we want to open up into a palm forward position. And you can just take your fingertips under the where your elbow hinges. There's a little bone there that when you turn your wrist, it's a little circular type of a joint. And you just get your hand under there and extend the elbow with the palm down, and you can use the wall to add an extra type of a stretch to it. So my hand goes against the wall, and you can control the position, whatever's comfortable for you, whatever height, to get some stretch through there, some extension of the wrist, and get that elbow joint really extended and what's called supinated instead of being in that prone position. And just have fun with it. You can hold it for a period of time. You can give just light upward pressure just to get that elbow in more of an extended position. And I would do that with both wrists, even if it's commonly the right one will be worse because that's the hand people are doing their mouse stuff with. So you get that, again, that supinated position and lean into that.